Hello everybody, this is Dr. Sagar Karvir, orthopedic, fracture and joint replacement surgeon. I am practicing in Kandivali West at Ayush Nursing Home. Today we are going to speak about a patient awareness regarding the allied program for musculoskeletal disorder, wherein we are going to speak about the importance of musculoskeletal health. Now, what is musculoskeletal health? It is the optimal strength of your muscles and the bones which are necessary to allow a person to perform his activities into an optimal manner, be it mobility, be it dexterity, or be it strength. Our orthopedic motto is life is movement, movement is life. So, as an orthopedic surgeon, we always strive to make our persons or patients mobile enough to perform his day to day activities in an effective manner. Now, if a person is not having adequate musculoskeletal health, then his ability to perform his day to day activities are hampered, as a result of which there is lethargy, low productivity, inability to perform day to day activities, as a result of which the person becomes dependent about others, he becomes lethargic, obesity, and in many cases, especially in the elderly group of people, due to the dependency on others to do their activities, they become depressive. Now, this may lead to a lot of non communicable diseases setting in. As I already mentioned, obesity, diabetes, cardiac issues, which take a big toll on the day to day activities of the patient. Now, what are the causes of this low musculoskeletal health? Now, globally, it is been proved that as a result of our sedentary lifestyle, on an average, people are spending around 4 hours in front of a screen. And in COVID times, since work from home and all those activities, the screen time is increased. Modernization has given us the boon of many gadgets, which has made the necessity of physical activity very less, as a result of which the lifestyle has become sedentary. Due to the sedentary lifestyle, the mobility of the joints, bones, and the muscle strength goes down. Secondly, modernization, as I said, has introduced our tongue to different flavors of food which are not necessarily healthy. Fried foods loaded with cheese, mayonnaise, and high carbs increase the caloric content of our body, which also is a cause of obesity and low musculoskeletal health. Third thing, the lack of exercises, day to day activities becoming more sedentary is the most important cause of musculoskeletal downfall of the health. Now, having said that, what can it be done? It's a simple thing. In fact, WHO has recommended that a 20-minute exercise, maybe just a brisk walk, a cycle, or a jog, is fair enough. And those of us who cannot dedicate 20 minutes a day, if on our weekends, that Saturday and Sunday, a couple of hours of exercise, which would be high energy, would be necessary. Now, older people can do a lot of cardio activities like walking, cycling, slight jogging, that is also helpful. Nothing is more important than to be peaceful at mind. So, if I start my day early by a 15-20 minutes brisk walk, my whole body is energized and reviewed. At the same time, I would suggest that we should take a daily requirement dose of calcium and adequate vitamin D to ensure that the bone muscle health is better. At the same time, our diet should contain high proteins which are necessary. Now, proteins can be taken on either sources. For vegetarian people, you can take in the form of whey protein, which are good enough to maintain an adequate muscle strength.
Low muscle mass is called as sarcopenia, and at the same time, low density of calcium into the bones is called as osteoporosis. So now a joint which is formed by two bones and the muscles which cross, if both the building blocks, that's the muscle as well as the bones are weak, the joints also become arthritic and hence functionality is not appropriate. As we speak musculoskeletal, musculo means muscles and skeletal becomes the bones. Both of them are important because they are the building blocks of our joints. In the older group of people, when the muscles as well as the bones become weaker, the joints also take the toll. There are many degenerative disorders of the joints leading to a symptom called as osteoarthritis, which also decreases the mobility of the joints. So, if we take it as a whole, my muscles are weaker, my joints are painful, my bones are weaker, as a result of which my mobility is damaged. Hence, the dependency increases, as a result of which the depression in these older people increases. So, my advice would be to maintain a healthy and an active lifestyle, which would include at least 20 to 30 minutes of brisk walking per day, maintaining a diet high in proteins, low in carbohydrates, and avoid fried foods, and at the same time, taking the recommended dose of calcium and vitamin D as supplements for your bones.